Chairman, Fortis Escorts Heart Institute. Dr. Seth, let me take your first reaction when you have an EU coming in for a vaccine for children. How do you think that will help us in blunting the overall impact of the increase in cases that we're seeing, also the added pressure of the Omicron variant?
So let me just say that it's a very welcome move. I know that Tagi and NEGVAC have been actually going over the data for some time to make sure that it was safe for the children. And the children, unfortunately, have been missed out. 12 to 18 have been in the formative years. It's so important for them to be vaccinated and therefore actually be in that situation of having proper education and in-person education. I think extension of vaccination in every subgroup at the moment, when we have enough vaccines available, is a very welcome move. And I hope that more subgroups are taken into consideration as we go along, because at the moment, while there is vaccine hesitancy on one side, there is surplus of vaccination still available to vaccinate more people and more groups of people.
Okay, let me take the first reactions from Dr. Rama also. Dr. Rama, in the last 2 years, we've learned a lot. The first hurdle was to develop a vaccine. Now you already have that. To tweak it as per the needs of various subgroups, it becomes a lot easier. How do you see this big development coming in as far as vaccine for children?
I think it was not about even 2 hours ago that you asked me the same question, and I just answered that, I think the children should be vaccinated. It's absolutely important, and we're sort of disregarding a vulnerable population. So definitely, I think it's a step in the right direction. I really congratulate the policymakers of the country to have made that strong decision quickly enough, not only for any kind of COVID virus, but also for the particular variant that we are seeing right now, for all the reasons that were mentioned by the previous panelists. So I think it's a great move, and it would be important to roll it out quickly, because not only is it saving lives, but also allowing the children to have a normal childhood and the education that's been sort of on standby and on hold for a long time now.
Okay. Dr. Bagai, I want to come back to you. What are the kind of patterns that we're seeing in terms of impact of this new variant on children, thus making it even more important for that vaccine to come in? Okay, we'll try and get Dr. Bagai back, but let me take that question to Dr. Seth. Dr. Seth, the same question to you. What is the kind of pattern that we are seeing on the impact of children alone, which will actually help us understand how a vaccine could contain that? Dr. Seth, if you can hear me. Okay, we'll try and get Dr. Bagai and Dr. Seth back. But Dr. Rama, if you would want to answer that, what are some of the patterns that we're seeing in terms of the impact on children currently, to help us understand the numbers that we're seeing globally as well?
So if your question is about what does COVID do to children that's somewhat different from the adults, it has a multi-system inflammatory response, which is a lot more severe, a lot more widespread, and a lot more quicker, so it tends to be a lot more fatal, almost, if you will. So it's called MSCAI, which is for children. So definitely the only thing that we can do, and the use of medications that we commonly use in adults.
Okay, Dr. Rama, I just apologize for interrupting. We also have Dr. Naresh Trehan now joining us on the phone line. Dr. Trehan, good evening. Good to have you on the broadcast with us. Your